Hello, everybody. Welcome to Optimum Ed Live on a wonderful fall Thursday. The leaves are coming down, the wind's blowing, and I know what I'm going to be doing this weekend. So, we are very excited today to have a special guest with us, Dr. Amanda Watson. She is a doctor of physical therapy with Progress Therapy in Midlothian, Virginia. Now, you're asking yourself, what is Optimum Ed? A higher education advisory firm talking about physical therapy. I'm old and I need help. No, but that's not the reason. No, it's because part of what we do is spend time talking with young people about direction in terms of life and career, what makes sense for them for the first job and first foray out into the world. We spend a lot, and part of what we want them to do is to get information from people who do the kind of work that they think they want to do. Get advice and understand other people's journeys so they can make better decisions. So OptimEd is going to start having a series of guests that's going to address just that. And the reason is because if a young person doesn't know someone who's doing what they think they want to do, then we're going to have a library of these interviews that they can lean on. So that's why we're starting. And Dr. Watson is the first guest. So no pressure.
No, none at all.
Okay. All right. So first of all, let's tell everybody how you became a physical therapist. What brought you to physical therapy?
Yeah. So I think if you were to ask almost any PT, they would probably have a similar story that I do. And that is when I was in high school, I was a senior in high school, and I was on the varsity soccer team. I was captain. It was like our first scrimmage of the season. I tore a ligament in my knee. I tore my ACL.
Oh.
And so I didn't play soccer that season, needless to say, but I had surgery, and I had PT for like 5 months or so, 6 months or so after the surgery. And I really didn't know what PT was before that, to be honest, but it just seemed like a very fun job. It seemed like a very active job. Mm-hmm. You weren't, sitting behind a desk all day. You're up and moving around and exercising and talking to people, meeting different people. And so that's sort of what got the ball rolling, if you will, when I was thinking about what I wanted to do in college and beyond that. So great. People have very similar stories, I bet, if you ask other PTs too.
Yeah. Well, I think, understanding the type of work it is, it's not a desk job.
Yeah. Obviously. Yeah.
You're going to be active. You have to have the ability to do things like twist people's arms. No, I'm just, it's a physical, it can be physical as well.
Yeah, it can be. And I think having the understanding that you have to be able to relate to people, first of all, but be able to relate to different kinds of people, because you see men, women, kids, all ages, all races, all ethnicities, and you have to be able to bring what you have to the table and bring it to their level. So
that's a very good point. That characteristic is very important. I was going to ask you that. What was the one thing that you think is really important in terms of considering this job? So let's talk about education. So you're a doctor of physical therapy.
Yes.
Does someone have to aspire to that to be a physical therapist?
Yes.
Oh, okay. Talk to me about that.
So way back when the field was first getting started, you could get a bachelor's degree and call yourself a PT. And then they slowly made the transition to master's degrees, and now the majority of the programs are doctorate degrees, clinical doctorate degrees. Mm-hmm. And so for those PTs who've been in the practice for a while, they have transitional programs if they do have a bachelor's or if they do have a master's degree. Transitional programs into a doctorate degree, a DPT is what it's called. Mm-hmm. But if you're new to the field, if you're a new PT, your degree will be a DPT, which is a doctorate of physical therapy. So you don't have a choice in the matter.
You don't have a choice anymore.
No.
Right, so what is the time commitment?
It varies program to program depending on if they give you like a summer break, if they have you coming in all year, and then maybe you get like a week or two here and there as opposed to a few months. But for the most part, they're 3 to 3.5 years.
Oh, okay.
Yeah.
So is one if someone is more inclined to look for something more athletic than science based, is that is that something they should think about? Because it's not really well, I guess let me ask this. How science heavy is this curriculum?
I mean, it's not as science heavy as like a med school program, but you do have to take a year of biology, college biology. You do have to take a year of chemistry, a year of physics.
Anatomy?
You do have to take anatomy and physiology. You have to take an exercise science class. So it is still science-based.
Okay.
If you were looking to be more of like an athletic trainer is a good option for somebody who wants more of the sports, but maybe not quite as much of a commitment as a PT program would require.
Okay. Yeah. We have a lot of kids that are interested in the sports piece of this area. So what's the difference between, say, an athletic trainer and someone who is practicing sports medicine? Is the one a doctor and the other is, not a medical person? Am I thinking right or not?
I would say they're both medical people.
Okay.
Trainer, as far as I know, athletic trainers, they have a athletic training degree. I think it's called an ATC if I'm correct, but I could be wrong. And if you were okay with the sciencey piece of PT, but wanted to be more of like a sports specific PT, that's fine too. Our national PT association has a very intense sports certification that you could get if you wanted to specialize in seeing high school, college, professional athletes. You could sort of make that known in PT school, and sometimes they offer special like module classes or special like observation hours in sports specific clinics, and so you could do that as well just to make your interest known right off the bat.
So I know, looking out there at the college and universities, that physical therapy is much more prominent than, say, sports medicine per se. I mean, so my question is, if someone was interested in sports but wanted to get into that field, can they take their physical therapy education and go and take it to sports in some way?
Yes.
You can. Okay. All right.
Not necessarily to be like a medical doctor, but you could be you could be a PT and work with the Washington Redskins. You could that's their name, the Washington football team, excuse me. You could take your PT degree and work with like a college program. That I mean, there were a lot of classmates in my year who had the same interests, like the same ones we're talking about right now. And that it's doable. I would say there's probably a little more competition there just because that's more of what PT is known for is the like sports specific injuries.
Right.
And so there's definitely more people that you would be competing with for jobs if you wanted to think about that on the latter end of your PT program. But it's doable. Yeah.
Okay. So sort of following on from that. So there's different ways you could take your physical therapy degree. So you could, and tell me if I'm wrong, you could work for a big hospital in some way.
Yeah.
You could work for or you could start your own business. All right. So my question is for you, why progress physical therapy where you work? Because it's a smaller practice, right?
Yes, it is.
Okay. So is this a personal preference or is there, how did you come to that?
So there's a wide range of settings a PT could work in. You'll find them in hospitals. You will find them in skilled nursing facilities. And you will find them in outpatient clinics, which is where I am.
Mhm.
And I think I always knew I wanted to be in an outpatient clinic.
Okay.
To me, there's you have to know more. You have to have a very well-rounded approach to PT to be able to work in hospitals, because you see a lot of different kinds of PT patients. You see post-surgery, you see cardiac patients, you see stroke patients. And that to me was a little overwhelming
Okay.
coming
Yeah.
out of PT school. So I knew I wanted outpatient.
Right.
And I've always been an outpatient. And I do work in a specialty PT clinic. We see mostly patients with any kind of pelvic dysfunction or abdominal dysfunction. So that could be pain with emptying bowel or bladder. That could be pain with
Interesting.
intercourse.
Okay.
It could be any kind of things going on during pregnancy or the postpartum period. It could be any GI surgeries. I mean, it covers a wide range of things.
Yeah, so it's not just bones and muscle.
It's not just bones and muscle. No, you got to talk about what people are eating.
Yeah.
How are they sleeping? All that stuff.
Yeah. So, and this is probably a personal question, but I think one of the things that young people have to look at when they're choosing direction is their investment of time, energy in this endeavor to get this degree. But there's also a monetary piece to this that are a lot of student, if not the students' minds, the parents' minds.
Yeah.
Well, and is the return there? I guess. Honestly, do you?
That's a good question.
Yeah. Do you feel like you got the return on your investment at this point? Or are you still on that return? And you don't. So maybe that's
No.
Yeah.
I'll give it to you straight. I feel like, so to me, it's not as important to me, like making lots of money, as learning more about the specialty I'm in and being able to make connections with people and help people. Okay. And so I don't feel like my return has been paid off. But I think a lot of that also has to do with the medical system here in general and how insurance companies are reimbursing us, and it's more of that kind of an issue than anything else.
Yeah, but I think you made a good point, and is that being a physical therapist, you have to be a people person.
Yeah,
you have to want that to be able to help people more than you want to become rich. Obviously, and so I think that's a really critical point to make here. As we end our conversation. So you got physical therapy, you got to get a doctor or a doctorate in physical therapy to be viable.
Yep.
And you're not going to get rich, but you're going to be able to help a lot of people and sleep good at night.
Yeah, you can make a really big impact in a lot of people's lives.
Exactly. Very good. Yeah. Well, Amanda, thank you very much for your time today. I appreciate it. And you have a good weekend.
Thank you. You too.